Welcome to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and Tucker and I would like to invite my three guests today. We're going to be talking about an important topic that I don't think is discussed enough, and that is the topic of stroke and how stroke impacts our daily living, how stroke can be rehabilitated so that you can recover, and what are the steps to do that. And I want to, first of all, before I introduce our guests, I want to say that I'm quite aware of the importance of talking about all this, but I'm also aware the courage that it takes to come on television and talk about something that is so personal and so impactful into your daily life and your family's life. And I give you kudos for Monica for coming on and doing that.
Thanks.
So with that being said, let's welcome Monica and Mark Loskey and Donna Heinrich. Now, Monica had a stroke, and Donna is part of Crossroads Speech and Hearing, and she is part of Monica's rehabilitation.
Yes.
So I asked Donna to come on so that she can give a professional take on what happens with a stroke and how the rehabilitation process occurs. And then Monica and her husband Mark are going to talk about what actually happened and what has happened since the stroke.
Yes.
So welcome to Healthy Pets, Healthy Owners.
Thank you.
I mean, it's such a delicate conversation because a lot of people don't want to talk about this.
Yes.
And it can happen to anyone at any time. What actually happened with you, Monica? Had you had signs that you were aware of prior to having your stroke?
No, but I had hot and a little bit of a headache.
And how long before you actually physically had that stroke did you have those signs?
Really soon.
So there was nothing that you were having a problem with up until the point?
No. Yes, that was right. Yeah.
Did they ever come across the reason that they thought you had the stroke? What the cause of the stroke was?
They said a cranial hemorrhage. That is all they know, and they no
root cause of it.
No
No.
cause. There was nothing
No.
associated with medication or
Yeah.
with a bump in the head or
Yeah.
anything like
They-
heartbeat that was
Yeah.
off or anything.
No.
And to this day, we still don't know.
Right.
And that's the scary part of all of this, because it can happen at anybody at any age for any unknown reason.
Yes.
How old were you, if I may ask, when this happened?
57 for 6 months.
And what are the circumstances that led up to this stroke that you started to sense? Because I know that the backstory in this, which Monica is going to talk about, is kind of interesting. So you were doing your normal daily routine.
Yeah.
What was your profession?
Guidance counseling, and I was working at home for not school time, and I was cleaning out my closets for the coming school term. And I felt weird and icky and said, maybe I can take a shower.
To feel better.
Yes. In the morning. And well, not long after I was in the shower, I heard a whack and felt pushed out of the tub. And I was laying there.
So that whack, do you think, was a blood vessel breaking in the brain?
And in retrospect, but it's not that, yeah, now, but that for the time being, I didn't know what to think. I was laying there on the floor, but I don't know how long. And once I got up, really slowly, nausea started happening.
So those could be the symptoms of a flu,
Yeah.
sudden stomach virus or
Yes.
something like that.
Yes.
Were you home at the time, Mark, when this
No.
happened?
No, I was at work.
You were at work.
Yeah.
So you were all on your own, and you probably were a little bit dazed at that point.
Oh yeah.
You
Yeah.
know. What happened as you started to realize and get yourself up?
Well, I cleaned up the mess and got myself clothes.
You were in that cleaning mode, cleaning
Yes.
up the closet, so you had to clean up the mess.
Yeah, and for the nausea, really bad, and I was dressing myself when, in a little bit a while, I said, got it myself together, and I heard somebody outside myself say, "Monica, you're having a stroke." And I said, "What?" I know what a stroke is, but I didn't say that to myself, but I heard it. And I got my keys and myself together to drive to Mark's work. 2 minutes.
So you didn't have any inability to walk, move your arms, your hands, or anything at that point. You just had this bad nausea
Yes.
and a little sense of disorientation.
Yes. And weird feeling under my axillary region. And
I bet that's a term you didn't know until after you had your stroke. and
well,
you learned,
I was a biology teacher
okay.
prior to becoming a guidance counselor.
Because from what I know, you seem to be one of these people that have, which I preach about all the time when I talk about healthcare. You took charge of yourself, even through the adversity of having a stroke, and really, you're not a medical professional, but you took charge to make yourself well.
Okay.
And to get better. And it's interesting that you even knew that term and you knew what to do.
Yeah.
I'm amazed that you actually got in the car and started to drive.
Well, I was taking care of my father. He had mini strokes, and I was on call.
So you were aware because you were participating in someone who had an
But
issue.
I said, "Oh, I have to get myself to the doctor." That is the mindset I had.
Which probably saved your life in a sense, although I know there's another aspect to this story. So Mark, Monica drove to your place of work, and then you both went to the hospital at that point?
Yeah, we left, went down and just got in her car and drove her down to the hospital, which is about 15, 20 minutes away.
And then what happened? Either one of you can answer this. What happened at that point?
I told him to say I'm having a stroke. I didn't know how long I will last for him to tell, but he...
Yeah, I went in and talked to the admissions at the emergency room, and I explained to them she's having a stroke, and they were worried more about other things, paperwork and everything else, and I had to finally go get a wheelchair, and she was sitting in a car out in front. And it was probably 70 degrees that day, and so it was warm, and I went out and got the wheelchair and got her into the hospital, and somebody came out of the emergency room and took her back to the emergency room, but then they told me I had to go move my car. So I went to move the car, and by the time I got back from parking the car and coming back, they'd already had her out on a table, and the doctor said, I'm treating her with a migraine cocktail, and she has a migraine. And
Because there is a medication that if you can take, and if it is administered quick enough, it stops the stroke from occurring.
they didn't do a CT scan. That was they didn't do anything like they say when you think of you having a stroke, they say get a CT scan and get everything else done. They said it wasn't necessary and they didn't do it. So after when you go to a doctor, the doctor is supposed to know more than I do, and when he tells you something that she's not having a stroke, then you have to try to believe what they're saying. Hopefully that's true.
Yeah.
But that was that part of it, and then we actually went home, and they sent her home, and so then you can go
So
on
they
from
gave
there.
you some medication for this migraine.
Yes.
Did it help?
I don't know.
Yeah, okay.
But he said, he said, we will work that out and you will feel better. But I didn't.
What was the time span from the time Monica went to your office to the time that you left the hospital?
Around noon, we left the hospital around noon, and she was mostly sleepy and groggy because the medicine they gave her made her very sleepy and groggy, so she went home and was pretty much out of it for a few hours or so, and then we decided around 4 o'clock or so in the afternoon. My car was still at work, and she said, well, I'll drive down with you and bring my car back home. So I was driving back home from the work in front of her, and I didn't see her in behind me anywhere, so I turned around and went back, and I found her along the side of the road, and she was slumped over the wheel. At that time, I had to call the ambulance, and they took her to the hospital again, and then they immediately said we're life-flighting her. They life-flighted her to a hospital in Pittsburgh at that time.
So do you think that your brain was bleeding? You had a brain bleed over that period of time from the time you left the hospital to the time you actually had a full-blown stroke?
Yeah. And I my last words were, oh, no, no, no. And I was feeling my body spasming.
While you were driving?
Well, I can't drive more and more. For my hand did this, and my leg was too long for the pedals. Yeah.
And so you pulled off to the side of the road, you went off to the side of the road?
Yes. Thank you for that.
Yeah, because there could have been a serious car accident
Yes.
at that point.
Yeah.
Donna, being a speech pathologist, you work with a lot of stroke victims. Do they have similar stories, or is this kind of an unusual story?
I think everyone is unique, and I think too, the family is so important to be involved also to help to understand and bring awareness to what's going on with their loved one. And you treat each person as an individual. So with Monica, her story leading up to the actual stroke was different, just like everyone is unique and individual. But the treatment also has to follow an individual path.
So most people that see you have some speech effect from the stroke.
Right, so that can take many different forms. In Monica's case, she was able to understand everything.
Yes.
It was more the expression of what she wanted to say. And sometimes that can be word finding difficulties, or it can be a motoric issue.
What do you mean motoric?
Sure. So with the muscle issues on the right side of Monica's body, that also affects the right side of her face. So she has a stronger side, and the muscles on the right side have been a little bit compromised. So a lot of times you might hear a slurring, or it takes more effort to form the words. So it can take a lot of different, a stroke can affect a lot of different aspects of communication.
And some of these strokes affect one side or the other, and some of them affect both sides.
That's right. Yeah, it can be devastating, and you know that firsthand, Monica. It changes a person's life and a family's life.
How long have you been working with Monica?
Since October.
Okay. Yeah.
So October of 2019?
Yes.
Mm-hmm.
Yes.
Well, that's a relatively short time. You're doing a wonderful job. I mean, I've had some experience with people who have had strokes, and their speech pattern took years to come back.
Yeah. It's been a progression. Early on, when I first got out of the hospital, they recommended the UPMC brain and stroke rehab, and they through their affiliation with the CAT lab in Pittsburgh, I was there for and they fitted me with a computer.
A wearable computer.
No, for like an iPad.
Okay.
And I was talking to that and learning my sounds, and for a little bit of for speech and more for oral exercises too. And they fitted me with that, so I will be, in case of emergency, I can say dial 911 and explain my emergency.
Are you taking any type of medication now as a response to this stroke?
Yeah, a little bit of blood pressure pills, but a lot of baclofen for the spasticity. That is the biggest holdup that I have. For my diaphragm, it's getting more and more pliable now, and that is why I can speak more and more now.
Are you pretty involved in assisting Monica with this procedure here and getting well?
It's been a lot of it. Looking for finding places for her to go to, doctors and different therapies and stuff like that. We've been through like 3 different organizations with therapy, but it's always been a progression. One has started us out, and then we moved on to somebody else that helped us a little more, and then we found someone else that's helping us, and now we're with Donna and a few other people, and they're helping her a lot now.
So it takes more than just Monica doing things on her own.
Yeah.
It takes the support of someone else.
Well, she can't
advocate.
drive or anything. She's
Yeah.
unable to drive yet, and and we're on the road about four days a week to doctor's appointments and therapy and stuff. So it's yeah, it's a lot of and we've been different places. We've driven different places to go, but
And for the phone calls.
a lot of phone calls.
Oh,
yeah. When it started out, she couldn't speak at all. I mean, when she was first in the hospital, she would point to things and stuff, and then if I couldn't find out what she was telling me, she would throw something at me to get it. But
So then she would get frustrated,
Yeah.
and you would get frustrated
yeah,
as well.
But
Yeah.
you know, then like I said, it was so. I mean, Monica's been a talker all her life. She's always in her schoolwork and everything else, and giving speeches and stuff. And when she couldn't talk, it was really a shock, you know. But then she came back, and you know. Now she's coming back real well now. She you know, does a very good job of talking now, and
You know, everybody looks at a stroke, and you always refer to a stroke victim, and I don't think you see yourself as a
No.
victim. I can pick that up.
No.
But people don't realize the impact it has on family members and friends and so forth.
Yeah.
And,
yeah,
and
it's
can
tough.
you address that a little bit of some of the things you went through, Mark?
Well, a lot of the things you have to, your whole, when it happens, everything changes because your whole financial situation changes. You've got a lot of extra time that you have to do other things that you can't do what you're normally used to doing. So you have to spend time, and like I said, a lot of it was researching to find the right people, the doctors and stuff. That's so important. Is what we found through the years here is finding the right doctors and finding the right therapists and stuff to go to, because the very first doctor that we went to for her to see told her that I don't think you're going to get any better, and I wanted to put you on pain medication. And that was we walked out of there and never went
Well,
back.
good for you.
Yeah.
I mean, I tell my story so often enough, maybe too much. You know, I had 26 years ago an issue, was told to go home and die.
Mm-hmm.
You know, get your affairs in order.
Yeah.
I refused to listen.
Yeah.
You know, you have very bright people, you know, with doctors in front of their name.
Mm-hmm.
And, you know, as a medical professional, I understand what everybody goes through. And
Yeah.
you have to be a certain type of person to even want to do that. And then to go through all of that and give up so much of your life to be educated. But then I think you get stuck, you know, and you stop seeing people as individuals. And you have to look at each individual case.
Yeah.
And, you know, nobody's walking around with a barcode on their forehead that says on this date it's done. So
Yeah.
no matter what
Yeah.
happens.
Yeah.
You know, and you've got to do. I did it. I think you're doing it. Take charge of yourself, and with the assistance of family and friends and professionals like Donna.
Good teacher.
Yeah, to get in there and go beyond and not accept what somebody tells you. And I would you agree with that,
Yes.
Monica?
Yes.
Not an easy thing to do, though.
Yes. But it's getting better and better. Yeah.
So, Donna, what happens when the first time somebody comes to you as a patient that has had a stroke and has difficulty in speaking? What's the first thing that you do?
I was listening to what you were discussing, and I truly believe there's an art to what we do as well as a science to what we do. So part of the first session is I just listen. I listen to what the patient's telling me about their stroke story. I listen to what they feel that they aren't able to do and what they want to be able to do. And then I try to work my goals, almost overlay that onto what they identify as being their priority, their focus.
So how long have you been doing this?
23 years.
23 years. And you've been with Crossroads Speech and Hearing for that
The whole
period
time,
of time?
yes.
Yeah, they're a good group.
Yeah.
Yeah.
And I love it because we meet so many fascinating people. With Monica, the first day I met you and Mark, I could tell they were motivated. Very positive, very wanting to follow through with everything that we designed for a home program. There was a lot of cooperation, and that helps to make my job easier, so to speak.
Well, I think what happens when something like this happens, or when somebody's in a state of illness, of what I call dis-ease. I didn't say the word disease, I said dis-ease. you go to some professional and you think they have the magic bullet, and so I think the average patient wants to throw that on the professional and say fix it. But I think in order to change things around, the patient is controlling the magic bullet. You have to have the will and to fight. To go back to, it may never be normal, right? And I use the word normal meaning what it was like before your stroke.
Yeah.
It may never get there. Yeah. But you're striving to
Yes.
achieve that,
Yes.
and then in the process you end up seeing improvement.
Yes.
You know, were there periods of time, Monica, when you became discouraged?
For a little while, but not for days. No.
So you always had this sense of hope.
Yeah. I like a bad dream. I woke up really soon. I will wake up really soon.
Well, it's kind of like, I think this situation is kind of like you're driving down the road and you get hit by a Mack truck. Yeah. And you survived, which is wonderful. I mean, that's half the battle, right?
Yes.
Yeah, you know, I actually lost my father to a stroke. Oh. You know, he had a TIA, went to the hospital, they misdiagnosed it. He had a brain bleed and 2 days later was dead, died. So the impact I felt, of course, right? You survived that.
Yes.
That's a major blessing right there. And I think it's amazing your little guardian angel or your guardian angel put those words in your ear. You're having a stroke. Get to go for help. Yeah. And that may have been the difference there. Too bad the care at the time wasn't on spot, okay, for whatever reason. But you took this stroke and now are healing from it. So what's the first thing that you did when you got home after being diagnosed with a stroke and going through? I mean, we haven't told the story. You ended up in a wheelchair, correct? You couldn't walk.
Yeah.
It was that you couldn't talk and you couldn't walk.
Yeah. And my hand too.
So you were a professional in the education system, and all of that went away in a day. And then, and then you suddenly got to the point where you really needed help just taking care of yourself.
Yeah, I was really active, mentally and physically. Yes, thank you. And that all went away, and I have to get it back. But for 2 weeks, I was in a coma state for the comatose state.
Was that because of the medication or because of the stroke?
No, it was because of the stroke.
So you had a brain bleed, swelling of the brain, pressure in the brain, and put you in a coma.
And for 40 days, for the acute care and the...
Yeah, she was in, after that, then she was transferred to another hospital for it was about almost 50 days. She was in the hospital for beginning the training and different things that they did work with her and stuff. So.
Yeah, which is amazing because they don't like to keep you in the hospital very long.
Yeah. And when we came out, I was at for appointment for the stroke for the doctor for the Botox. Then they said, "Oh, you have to change to Heinrich, not."
Well, insurance always has a big impact on.
Well, that is the next leg of the journey. All new caretaker.
Yeah, so you called that a journey. I would call it with insurance a battle.
Yeah.
You know, the mix-up here is there's a difference between health insurance and health care. We need health care. in better health insurance, you know, a fairer health insurance. We're going to take a break here on Healthy Pets, Healthy Owners. We'll be back with Donna, Heinrich, and the Loskys, Mark, and Monica. Monica has this, I think this story of encouragement is what I'm getting from your conversation here, Monica.
I hope.
We're talking about inspiration and how to overcome a stroke. We'll be back here in a couple minutes. Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we're here having a wonderful conversation with Monica and Mark Loskey, talking about Monica's stroke and her recovery and what it's taken to get from where she was from the day the Mack truck hit her, in a sense, to where she is now and where she's going to go with this. And then we have Donna Heinrich here from Crossroads Speech and Hearing on the professional technical side of things. Donna, and I thank you so much for taking time out of your busy schedule to come here and be here with the Loskys and talking about this. The question I have for you is, you know, everybody's so caught up today in technology. You know, in fact, during the break, Monica was mentioning how she has an app for this.
Right.
So how is technology impacting us with situations like a stroke, and what we can do for the speech part of it?
There are a lot of apps available for iPad, even for smartphones. They can do a wide range of things to help a person who's trying to overcome the stroke as far as their communication. Monica uses an app for exercises to help to strengthen and gain range of motion for her mouth muscles.
Because when the stroke happens and those trigeminal nerves are affected, you don't have the muscle movements or the tongue movements in order to form the words.
Right. So you have to work on that coordination all over again. And some people who, if their speech is severely affected, they might know the word, but they can't get it to come out.
That happens to me on this show
Right.
sometimes. I know what I want to say and I can't spit it out.
And there are apps to help people through that experience where you can press a button and it'll say it for you, and you can even repeat the word, so you even gain practice in that sense too.
So what was it like, you had mentioned you've been doing this professionally for 23 years, and your educational process up to that point was, I'm sure, different than the educational process of people coming out into this profession now, as it all changes so rapidly. But what did you do before some of these apps?
We went old school. It was paper and pictures, and people would point to pictures on a board, and you didn't have that vocalization to go with it, but you could at least point to the corresponding picture to make your sentence or your thought.
Do you think the technology is making this more efficient and more effective?
It's more real time, so you don't have to flip through picture books to get to where you want. You simply just press the icon and it's there for you. So in that sense, it really has sped up.
Now, you had mentioned to me about a device that Monica's wearing, and I'm going to ask Monica to show that device if she would. But would you tell us a little bit about that, and then Monica can pick up on that?
Monica's stroke affected the right side of her body, and along with that, there was some spasticity, which is a problem with her tone.
So define that a little more for the audience. You know, it's an interesting word, spasticity, but what does that actually mean?
Monica, you can probably...
Locked up.
Yeah.
So tighten muscles and...
That a muscle so tight that you can't overcome it.
That's because the nerves are no longer providing that electrical impulse to stimulate those muscles. Is that what's behind that?
Yeah, my understanding is it's something for the spinal cord to help the brain compensate for the whatever it's missing.
So this device is called a Bioness?
Yes. You have to get, it's not insured, but I learned about it. The first book I read about it was Stronger After Stroke by Peter Levine, and he talked about it.
So this again is you taking charge. You read the medical profession didn't come to you and say we have this device. You found it in a book and said, hey, I'm interested in looking to see what this device can do.
Yes.
That's the word that's you empowering yourself to improve your condition.
Oh,
And that's what I hope the audience takes
Yes.
from this conversation that we're having is we have to look to ourselves to improve our condition of what's going on with us when we have something happen.
and I can show it.
Do you think we can scan down and look at this? Because
The Bioness, that is a leg brace for my ankle. That is independent. Everybody can get one. For the ankle brace is a little bit weak yet, but getting stronger. But now it's the computer is there, and the pads are in there. They wet. I have to make them wet, and for a muscle stimulator, and it's helping me to learn my my tendons and muscles which fire down my ankle and foot.
that's absolutely amazing.
Mm-hmm.
So that should help actually speed up your recovery.
Yes, I can feel that happening. I was on it since August.
August. So
Yes.
we're 6 months.
Yes,
How long did you spend in the wheelchair?
a year, a little bit over a year.
And how long did it take in that year span before you started, from the time you had the stroke and were in the wheelchair to the time you started to feel like, hey, I can get out of this thing?
September, I was more and more on my own, and the big leg brace, and more, and I said, I know I can do it now, but it's coming along all the time. Everything is new all the time.
And Donna, the speech pattern when you first saw Monica and the speech pattern today, how different is that?
When I first met Monica, her speech was a little bit more halting. It wasn't that natural cadence of speech. And you can hear now that she's carrying on conversations, and you can even tell with her face muscles, they're symmetrical, and she's getting more movement down and through her neck muscles even to support.
Yes.
And we've been working a lot on breathing so that she can string more words together like natural conversation.
Because it's impacted your diaphragm,
Yeah.
so therefore you don't have the breath to even sometimes generate the
Yes.
words in consecutive
Right.
pattern.
Mm-hmm. And I always enjoy, I think my favorite part of our session, Monica will say whatever it is that's new. This last time you told me that you could feel the bottom of your...
Yes, my heel and my ankle is getting more and more feeling it in my whole foot for the sole. It's getting more and more deeper. Yeah.
I would imagine you had drop foot after
Oh,
this
yeah.
and so forth, and
Yes.
that in itself is a problem, drop foot.
That is the bioness, and the foot sensor is helping me to overcome that more.
So for you to have a right side effect, the stroke happened on your left side.
I'm in my right mind now.
No, I got to tell you, I'm going to ask you to be our poster child for this, because you actually embody what my philosophy is, and that's doing exactly what you're doing to make yourself well. I always use this word empower, and I probably said it 3 times already on this show. You're doing exactly what we should be doing, and that's taking charge of yourself.
Yeah.
And you're seeing the progression, and I think Donna's seeing the progression too. I can tell the way Donna smiles when you talk that she sees you doing that.
Yeah, thank you. I have help.
It requires help,
Yeah.
absolutely. It requires medical science. It requires support from people such as Mark.
I know.
You know, and no one does anything on their own. But really, it has to be, I think, inside you. You have to have that will, that fight to overcome. I mean, you have obstacles, daily obstacles.
Yeah.
And
Who doesn't? Who doesn't?
everybody does. I mean, just getting out on the highway is a daily
Yeah.
obstacle. But you have obstacles that we take for granted. You know, I mean, I went through some medical conditions too,
Yeah.
and I understand some of the things you're going through and the effort it takes to even get in and out of the shower. So you deal with that, but you're building upon yourself to make yourself well. You have that fight inside you. That's what I see.
Yeah.
And I think that's what we have to do when we have a health concern. We have to fight. We
Yeah.
have to want to fight, because you could easily succumb to this and say, "What's the point?"
I was so excited when I was learning to bend my knee. I said, wow, who knew?
Who knew? What were some of your inspiration?
Well, early on, when I first got my wits about me, I Googled some, and I said, celebrities who have stroke. And I really reading, I said, oh, Sharon Stone? And I said, well, and her story is a lot like mine. And
So Sharon Stone had a stroke,
yeah,
which was something I was totally unaware
me
of.
too. And 48 when it happened for her. She was training for a 5K for a fundraiser.
So if you're at that point, you're in pretty good physical health.
Oh yeah, yeah. And she said something is wrong. And she said the doctors didn't believe in me.
There we go.
I know.
It is very similar to your story.
And when, for I think 9 days, she was bleeding for her brain. And finally, one doctor caught up with her, and she liked him. And she credited him with her life. And she was in for foot drop, and her head was making no sounds. And for pen. She said she had to learn to hold a pen.
Wow.
And she said for 3 years, nobody, no offers, and she said once, maybe for 10 years, all gone now. But now she is resuming her career, and I recently saw her accept the award for Women's Advocator for Brain
Recovery.
Yes. Yeah.
It's an amazing story, and here you were able to use her as your inspiration,
Yeah.
and figured if she could do it, you could do it.
Yeah.
Wonderful. That's absolutely wonderful. Anything you could add from some of the clients you've seen, Donna, as to what other people have used for inspiration?
I had a client who was very into health and wellness and runs marathons. And she became very frustrated because she couldn't put her thoughts organized in an organized fashion. And so instead of doing worksheets and prefab therapy materials, she and I started to put pen to paper and write out her story. And that story became a book. So she turned her experience with stroke into a book to help others. So I think everybody works through their stroke journey in a different manner. And I think inspiration can come from anywhere. There's not, I don't think, any one of us that could say we don't know anybody who's had a stroke. We've all encountered someone at some point in our life who have had a stroke. So inspiration can come from just about anywhere.
There are a lot of things that can cause a stroke, and anyone could throw this in there. You know, I'll start it off. Sometimes medication can cause a stroke. What are some of the other things that can cause a stroke? And I want to tell everybody, we're not here to diagnose or to treat. We're just kind of here to make you aware and for you to, you know, be inspired to maybe investigate some things that you may be doing that are kind of dangerous. Certain medications, birth control pills for one, have a potential to cause a stroke. What are some of the other things that you've learned that can cause strokes?
There is a correlation between high blood pressure and the increased risk of stroke. Making unhealthy life choices, or, you know,
such as smoking.
Right. So it's important to keep good, healthy choices, keep your body weight and activity at a good level. So those are some of the things.
Sometimes you
just
don't know. Sometimes for the wiring is different.
Wiring can
and
be different.
You don't know.
And then if your heart isn't beating properly
Correct.
for some reason, it could throw a clot. Yeah. What are some of the signs and symptoms that I'm having a stroke? I mean, I know they're going to be individualistic for everybody, but some of the ones that you might
They
think are
say
helpful.
fast for the code word for face drooping, arm weakness, speech for slurring the words, or something not for the speech.
You know, have you found this to be true? And you know, I've heard actually jokes about this. If you could joke about a stroke, but smelling of burnt toast, is that something that you've heard that's true?
I don't know.
Some people say they have like auras prior to a stroke, but just like with Monica, sometimes that can happen with a migraine. So I think the important thing is if you feel something that's not normal for you, don't hesitate, call 911, get people there. And I think a lot of times loved ones are actually, we think of first responders, but a lot of times loved ones are first responders that see that something isn't quite right.
Right. So with you, they didn't do a CAT scan, which probably should have been done.
Yeah.
When you were being inspired by Sharon Stone, that happened in her case because you said she was complaining about certain things and
She was bleeding for 9 days before they finally took her in for the CAT scan. Yeah.
so she was complaining of something and they didn't have the sense to do a CAT scan.
Yeah.
And she was having bleeding on the brain for 9 days.
Yeah.
And I think stroke doesn't discriminate whether you're rich or poor, what area of the world you come from. It can happen.
Including age, it doesn't discriminate.
Yeah.
And a lot of young people are having strokes.
Right.
For the kids that watch the Game of Thrones, they say for Emily Clark, I think 2 stroke for her too. One's for last season too. And my time in the hospital, I was aware of really good girl. She has 29 and she has a stroke and her baby is 3 months old.
And that can happen after delivery.
Yeah.
You know, it's actually somewhat common for that to happen afterwards because of the change of the hormones within the body after birth. You know, the stress on the body during pregnancy and then the change of hormones after birth. I mean, it's really scary, you know. So you have the support of people like Donna,
Yes.
and agencies like Crossroads Speech and Hearing, and all these other facilities that you've gone through, the hospitals, everything. You have support from Mark. What other support have you do you have that's getting you through this?
God.
Your faith gives you that support to get
Early
through.
on, when I was in the hospital and I said, really soon I want to say the Our Father, and for my words, for my head, I had to sort them out, but I can't say them yet. But more and more, my psalms and my really good words come to me more and more.
So you were a biology teacher.
Yes.
And we learned during the break that you actually were a teacher here at Peters Township.
Yes.
Tell us a little bit about that.
All good times. That was my first teaching job. I was for AP biology, and for the shows, I did the Funny Girl and for Music Man, and I had the for science presentation and for PJAS and that.
And you started right around the time that Mrs. Robin Hodgson Frick started here, so you
Yes,
guys had a little reunion over here today. It was kind of nice,
Yes.
You know, I've got to tell you, it's wonderful that you look to Sharon Stone for inspiration. Now people can look for you for inspiration,
Yeah.
because you're inspiring me,
Yeah.
just sitting here listening and hearing you talk. And you're telling me that we can just about overcome anything. That's what the message I'm getting from you. You know, so not only can we look to Sharon Stone, we can look to Monica Loskey to do this. And we're going to have you come on Healthy Pets, Healthy People on AM 1250 here in the future, so that people could call in and ask you questions and actually talk with you. So hopefully you'll be able to come on and do that. You know, Donna, what all happens at Crossroads Speech and Hearing? So I have a stroke. I don't want one. So, but nobody wants one. But if we have one, and we've gone through the procedures, and we're ready now to go into our recovery mode, how do I get a hold of Crossroads Speech and Hearing? Do I have to go through my physician, or do I just call directly to you?
We do ask that you get a doctor's script to cover evaluation and treatment. And then we have 3 office locations. McMurray is the main office, Brentwood, and we have an office in Wexford. All the calls are handled at the McMurray office, and we'll be able to schedule an appointment for you.
And so you work with a speech pathologist. And just tell us a little bit about the training of a speech pathologist.
So we have our bachelor's, and then we have to get a master's degree. And we're all certified by the board, so we all have high degree of training. Of course, we all come with our little background information, our own unique experiences, but at Crossroads, like I said, we've been blessed to meet so many wonderful people, and it's really helped me as a professional to meet people like the Loskeys.
Yeah, and we want to thank Christy Conrad for
Right.
doing the job that she does with Crossroads Speech and Hearing and compiling such wonderful professionals. You know, I've actually I'm a patient at Crossroads. That's where I go to get my hearing test done.
Oh,
So,
And
Hey,
Christy's
you know-
wonderful too. She'll come in and greet all the patients. And
she's a dynamic person. She's
Right.
been on our show actually.
Aw.
Yeah, trying to get her on Healthy Pets, Healthy People. I just can't get her to
Coordinate,
commit
yeah.
yet. Hey, we're at the end of the show. This was an incredible hour, an hour of inspiration. I got to thank you both. You know, Mark, keep it up, man. You're obviously the backbone for Monica's recovery here. So
She does all the work.
yeah, you need that. You need that pole to lean on, though.
Yeah.
Monica, thank you so much.
Thank you.
Such a pleasure, such an inspiration. Donna, thank you again for bringing
Absolutely.
us the Loskeys to come on and talk about something that's so devastating, but doesn't have to be lasting.
yeah.
Hey, God bless you.
Thank you.
Keep it up. We'll see you next time on Healthy Pets, Healthy Owners. Thank you, everybody. Remember, you can see me live talk to us live on Healthy Pets, Healthy People on AM 1250 every Saturday morning, 9 a.m. Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. Bye-bye. That was extraordinary. Thank you all.